You're listening to Policy Currents, a weekly podcast from the RAND Corporation. I'm Evan Banks. It's September 29th. This week, we're bringing you a special conversation with RAND researchers Heather Williams and Dick Donohue. Before we get into the episode, a brief content warning for our listeners. This discussion you're about to hear focuses on the mental health effects of exposure to trauma, and it includes explicit references to violent and traumatic events. I'm here in the studio today with Heather Williams, Associate Director of the RAND International Security and Defense Policy Program, and Dick Donohue, Director of the RAND Center for Quality Policing. Heather recently co-authored a paper examining trauma in the intelligence community, and she is a former intelligence officer herself. Dick's research focuses on law enforcement issues, including police-community relations and officer training recruitment and retention. Before joining RAND, Dick was a decorated law enforcement officer. He's a retired sergeant of the Massachusetts Bay Transportation Authority Police. Welcome, both of you.
Thank you.
Thanks. You've both written about the effects of trauma and secondary trauma, and we'll get into the difference between those later, in both the intelligence community and in the law enforcement community. And we're here today not just to talk about that, but also to talk about your own personal experiences with both of those. I think let's just start with those personal experiences. You both have really very interesting backgrounds from before you came to RAND. Can you tell me a little bit about what those were?
So I was in the intelligence community for 13 years before I joined RAND. That was 7 years ago. And I worked on primarily Iran and terrorism, counterterrorism. I did 3 tours overseas, working directly with special forces in trying to identify high-value targets and to apprehend or kill them. And so those were a lot of my experiences that I sort of brought to this work. But since I've been at RAND, I continue to work on issues of terrorism or mass violence. So sort of my potential exposure as an analyst and a researcher to issues of potential trauma didn't necessarily end when I joined RAND.
Mm-hmm.
And prior to coming to RAND, I was a law enforcement officer. I was a police officer with the MBTA Transit Police Department in Massachusetts. I served there for a number of years before a life-changing experience that happened over the course of about 4 days, where there was, they say good things come in threes and bad things too as well. First one being the Boston Marathon bombing itself. So I was a patrol officer working a few miles from the marathon finish line. And, going into work, thinking it was going to be just a regular day. That was kind of the first life-changing experience. 3 days later, my friend and police academy colleague was murdered in the line of duty. And 2 hours later, I was in a gunfight with the Tsarnaev brothers, and I was critically injured. I was nearly dead for the better part of an hour. And, for the... maybe save some divine intervention. I'm still here today, and had since medically retired from the police department, and come to RAND a few years later.
I mean, one thing I've been curious for you, Dick, is your trauma was experienced in such a public way. I mean, here's this very personal experience, and everybody knows about it. How does that affect how you try to manage it?
That just means I don't have privacy anymore. When your entire life and pictures of, my then one kid are all over, national news while I'm still in a coma, and you wake up and you're like, whoa, hey, things have changed a little bit and I can't move my leg. And then, you have people visiting you, from my senator and the governor and the head of the transportation agency and every officer in the department, and I'm sitting in a hospital bed in a Johnny. It really is a lesson in humility, like really probably down, to the lowest level, right? I had people stripping me off in the street and giving me CPR and giving me mouth to mouth. Being, even running into people, one of my kids' hockey coaches, who I didn't even know this whole thing happened. He goes, "Oh my God, I didn't even put this together. You're Dick Donahue." Like, I am an X-ray tech at the hospital you got brought into. I remember you got brought in. Like, we worked on you, and he just turned pale as a ghost. And it is strange, but I don't think that might be just such an oddity in itself that it was extremely public. I just don't wish any of my entire experience to anyone else, and you just have to deal with it any way you can, other than just try to figure it out and do whatever you have to do and lean on the people you have to get through the next minute, hour, day, month, and year.
Yeah. Both of these communities, the intelligence community and the law enforcement community, deal with some very unpleasant things. And it's a necessary part of the job. And the people in those communities do that so they can keep other people safe, and so that other people don't have to deal with and see some of the things that the people in these communities have to deal with and see on a day-to-day basis as part of their jobs. But seeing and dealing with these things is not without consequence itself, correct? This is what you call secondary trauma. Can you tell me more about what that is?
Yeah, so I think in our communities, I know I'm speaking for the intelligence community. Dick can speak for the law enforcement community. Even some of the terminology about trauma isn't really directly understood and appreciated. So a lot of just people, and not necessarily professionals in this space, but people understand direct trauma, right? You were directly involved in a traumatic event. Dick's obviously experienced more than his fair share of direct trauma. But indirect trauma or secondary trauma is perhaps underappreciated. And so this is something that a lot of members of the intelligence community get exposed to. Let's say you're working really on any kind of issues that are going to involve violence, which a lot of us do. You might be working on counterterrorism. You might be working on counter narcotics. You might be working on an oppressive regime that systematically uses violence against its population. You might be looking at currently, the war in Ukraine. And so you are reading material and increasingly listening to or watching material about the conflicts or about violent events. And so you aren't there directly, you aren't experiencing direct trauma, but there's a cumulative effect of being, an indirect kind of witness of these events. And just because you are resilient to it today does not mean that you're resilient to it tomorrow. So there's a cumulative effect of seeing that kind of content over and over and over again that can wear down the emotional resilience of a person.
To give our listeners an idea of the kind of content that we're talking about, I don't want to be too graphic, but you wrote an op-ed in Politico, and the title of that op-ed is "Don't Tell Your Non-Work Friends About the Decapitations." For our listeners, like this is the kind of content you see through intelligence gathering, and it's just it's brutal. It's very brutal.
When Heather talked about, don't talk about decapitations with your non-work friends. Well, I happened to be at lunch in June, right down the street here in Virginia with some DC cops, and I'm out of the loop now. I'm 7 years retired, basically 10 years since I've really actively worked on a police department, and go have lunch with a couple guys, and we were actually drinking Coca-Cola for a change. I was kind of like shocked, and it's me, so retired cop, my buddy who's a homicide cop, and the other guy is a cold case detective, and the other guy at the table works for the sexual assault unit. So, I mean, they talk shop for the better part. I mean, we were there for 2 hours talking shop. And I think some of it might have been, getting my other buddy, who will remain nameless, he might listen in, getting him back in the loop as he's ready to get back in. But I think some of it too, I guess it was good we weren't at, quote unquote choir practice and we were, having soda and hamburgers, but it was kind of getting some of the, the emotions out, or the emotional trauma and stress out, and being able to discuss it. And even some of it that was, you hear, yes, I didn't believe this person because they're, they've been a drug user and abuser for a long time, and they actually got kidnapped and sexually assaulted. And then I had to take the statements, and then we went back on camera. Then we found this person getting kidnapped. And then we hear these stories over and over again. And it's not like, hey, and then I wrote the report, went home and called my psychiatrist, because that probably didn't happen. Or I went home and I got on did my breathing exercises and did X, Y, and Z. It was, then I was ordered into a shift. I had to put a uniform on and I had to cover another shift. Or I had to go back to work the next day, and hear the same sort of thing over and over and over again. But it was maybe an environment where we could talk about, some of the worst things. And I think part of it for me too is, even on a day-to-day basis, some of my best friends are still, on the force, and, my brother's a cop, so I still get a little taste of it, and I still kind of hear some of it. But yeah, naturally, if you bring some of those are some of the stories you don't tell at the dinner table with like mom and dad or the kids and that sort of thing.
I think this how a lot of people in these communities, in the law enforcement community and the intelligence community, process this stress is with their work colleagues, with their friends. That's who you talk to about it, because they're a group that understands your experience. And then sometimes they're a group you're legally allowed to talk to. If you're in the intelligence community and law enforcement too, you're not allowed to discuss a lot of these things with somebody else. And so I think a lot of people process and decompress from stress by using their personal networks. Use your family, use your friends, use your spouse. Those recourses are not always available to people in our community. And so you do have your work colleagues, and that's useful to a great extent. That said, as I've said, this community doesn't actually understand necessarily trauma. And they're also experiencing trauma too. So, the person you're trying to lean on is also potentially suffering. So there's not a lot of resources available, and there still is. As much as it's okay to talk about certain things over Cokes or beers or whatever it might be, but there still are boundaries and limitations and stigma inside of these communities. I'd be curious to hear from Dick about what some of them are for law enforcement. I know for the intelligence community, you would never, I think there's a real stigma against revealing that you're vulnerable, that you're suffering, that it's affecting your judgment in any way.
Is there like a belief that could affect your security clearance or?
Absolutely. So, the security clearance process has always asked about mental health, historically with very vague and open-ended questions. They've gotten more specific about what those questions are, but there's still a lot of, I think, anxiety about revealing that you might have concerns about your own mental wellness, which is actually, ironically, just creating more risk for the community, because there could be opportunities for someone to acknowledge that they have a problem and seek treatment, and there's no national security risk. But instead, there's such anxiety about it that they will just try to maybe sort of do self-care, or sometimes self-harm in search of self-care, like drinking or other detrimental negative behaviors. And that just creates greater risk in the long run.
And it's not like there's a network of like classified psychologists and therapists available to help, because even if they were, a lot of the way the intelligence community works is on a need-to-know basis. And so if you don't need access to particular information, then you don't have access to it. And so even if someone else was cleared, you may not be able to talk about some of the things that you've seen.
Yeah, I mean, there technically are, counselors and therapists inside the intelligence community. I mean, they exist. That resource exists. There are concerns about what even I could share with them. So you're absolutely right. Just because you have a clearance doesn't mean I'm allowed to tell you everything at any time and anywhere, in any circumstance. But there are employee assistance services in all of the agencies. But there are different cultural differences in the agencies, and there's just a lot of uncertainty for the individual and the individual who might be managing sort of their own stress, their own potential traumatic exposure, and the individuals around them. Like, I don't want to necessarily say anything about my colleague, even if I'm concerned about them, that could compromise their ability to keep their job. So just that, I think, does not. It's not a community that's going to be that outspoken about these things, and there's not a culture of mental wellness within the community.
Dick, how was that your experience too with law enforcement?
So similar, and instead of clearance, it's gun and badge. It's if you talk to somebody, if you seek help, if you're perceived as needing that, to the extent that someone's going to get the help for you, that your gun and badge are going to be taken away from you. I remember literally being in the hospital with tubes sticking in me. People say, don't talk to anybody about what happened. They're going to take your gun. They're going to take your badge. They're going to take your job. Didn't happen. But that is the long-standing, generational, generation after generation, law enforcement cultural belief. It's that if you seek treatment, they're going to take away your gun. They're going to take away your badge, and that means you can't work. It means you can't work your regular job. You can't work overtime, and you're out. So there's a fear in that, and obviously I said it didn't happen to me. My department came and gave me my badge, which was nice, even though for 2 months I was in hospitals. I wasn't going to go arresting anybody. They didn't give me a gun right away, but I think for good measure. Again, sleeping in hospital rooms for 2 months, didn't really need one. So even in my case, being through the situation, being very physically injured as well, that it just simply didn't happen. And then when I was recovered, quote unquote, enough, I did end up retiring. Went back to the range, qualified my duty weapon. We changed weapons. They gave me a new one, and there were no issues. So even kind of dispelling some of those rumors, but certainly having heard them from other officers beforehand, and even officers during those first few days when I'm just barely getting better and just barely surviving a gunfight, I'm hearing, hey, be careful what you say, be careful what you do, because they're going to take your job.
There's such a culture of being stoic and being, it just being part of the job. And it is part of the job, but... I
find it interesting, Dick, that you say this, because I do wonder if for cops, it's that gun and the badge is even more a part of their identity. Like, people in the intelligence community are very anxious about their security clearance. Nobody wants to lose your security clearance. We all recognize that that's a critical thing for you to work. But I don't know. I mean, you're still who you are. It would be a problematic for your employment. But I feel like to be a cop.
Yeah, and even in retirement, it's important. I mean, I remember being anxious, like, I'm out processing. Where's my retiree badge? Right? Where's my retiree badge? I have one. I still have one. I still have all my retiree gear and ID, just to have that tie back, right, to being in that. Even with all that I miss or like or dislike or have packed away, that I still do have that one thing. Interestingly enough, when I was thinking about talking about this subject, I think about one of the things that was given to me on day one of the police academy and given to everyone in our academy was a book called Emotional Survival for Law Enforcement. It was written, I don't know, probably 30 plus years ago. And it went over everything from stress management to things like, I'm sure you've experienced, hypervigilance, right? For everything like, hey, when you go to a restaurant, make sure you sit with your, facing the door, right? Don't wear a seatbelt because if you need to jump out, you don't want to get caught that one time, right? They didn't say to not wear the seatbelt in the book, but just some of these actions that you think about. Some of these, hey, when I'm on the job for a year, all of my friends are going to be on the job. I'm not even going to have a tie back to my life beforehand, right? I'm going to eat, sleep, and drink this culture up. And some of it was trying to be like, you got to distance yourself from it. You have to have some of these other mechanisms, either organizationally or personally. You need to have the hobbies, even when you're working 80 hours plus a week, plus commuting, plus sleeping in your car, that sort of thing. And it was just like, I feel like that book kind of still rings true every once in a while. I still have it up on my bookshelf. I'll take a peek at it every once in a while, but I think about it even when I'm at, working on some of these wellness issues here at RAND, or when I was at a site visit for something completely unrelated, and I'm working with federal law enforcement officers, and we're getting up at 3:30 in the morning to go and do work. And I just asked them, I said, how many days a week do you get up at 3:30 in the morning to do your job and then get home at 5 in the afternoon? It was like, well, I do this 5 days a week. And I was like, well, how do you cope with that? Because this is terrible. I'd rather work overnights than wake up at 3:30 in the morning. Like, how does your family deal with this too, right? You have kids or a wife or a significant other. How do they deal with that too? And what's that? I don't know if that's secondary trauma or just the secondary impacts of a certain type of employment. And I know, like, you've been deployed as well, right? It's not not an easy thing to have to deal with all that and then think about the secondary effects on other folks.
It's interesting you say that, because one of the things I thought was really interesting about this work that we did on trauma in the intelligence community is that as important as the potential trauma exposure is the environment that one is in when these things happen. So, as important as to whether or not someone can deal with traumatic stress is whether they're working long hours or whether they're working nights, or whether they're working for a supportive manager versus, a terrible manager. All of those dynamics really affect someone's resilience to stress. And the intelligence community, like law enforcement, can be really high stakes and a really, really intense environment. So I think that rings so true. At the same time, one thing I think is an interesting difference between our communities is this maybe concept of boundaries. I think, cops don't ever really get to turn off. You're sort of always a cop. And you live that identity day in and day out. Whereas if you're an intelligence officer, boundaries are actually very present and very important for your life. My work stayed at work. It did not go home with me. So I worked long hours, but when I walked out the door, I had to have hobbies or
But there were kind of like
facets.
negative consequences to both sides of that coin, where like you felt it was hard. I mean, and you couldn't talk about some of the things with other people. And Dick, it's hard to turn off and have a life outside of the work. It's interesting how both sides of that coin can contribute to this environment.
That's right. Yeah. But I think they do make it a little bit different, like how it presents itself. And I think that is really important for our field. We understand a lot about secondary trauma, and there are some universal truths about it that practitioners who understand it can bring it to different fields. But there are these unique aspects to these fields that we need to understand a little bit better. So this work that we did at RAND, I think, is some of the only work that's ever been done on secondary trauma in the intelligence community. And it has resonated so powerfully. I hear so much from people about how much it affected them, how much they related to it. And it's hopefully started an important conversation, but one that needs specific study. Like, someone needs to specifically think about what this means for this field. I think there's been a little bit more about that done in law enforcement and first responders generally. There's a better understanding of the fact that there are risks here. That doesn't mean that there isn't still more to be done.
There's a lot to be done on the research end. And I was thinking there was a report that came out from the Department of Justice, and, the Appendix B or whatever it was here are 30 different bullet points of possible, wellness, health and wellness solutions from everything, from EAPs to, using mobile apps to, anything you could think of, to critical incident stress debriefings, which there's research already on some of that, saying they're ineffective, but agencies keep using them. I guess I could go off on a tangent there, but I'll save my breath for another day. But I thought it was really interesting that they said here's a laundry list of potentially helpful things, but they all need research and evaluation. Every single one of them do. So whether or not that will happen in one fell swoop, I'm not really optimistic about that. But I am at least optimistic that look, we're considering all these things across the spectrum of law enforcement. It wasn't just DOJ for just feds. It was for the Department of One, to NYPD or the Border Patrol. This counts for everybody.
And I guess that just points to the newness of the field and the newness of the research, that this is something that people are realizing applies to a lot of different communities.
Yeah, or the resistance of that community to, these aren't necessarily that new.
Right.
So
Yeah.
some comments some concepts like moral injury are still a little bit newer, understanding that moral injury and the sort of these risks that might exist to harm an individual emotionally, mentally, by sort of violating their core ethics, or putting them in these situations where they're kind of feeling that the activity is immoral. So that's a relatively new concept, but I think these are both communities that have been, frankly, more masculine communities. They are communities that have historically had a specific sort of demographic type, and it's just not communities that are necessarily oriented towards their feelings. These are tough communities. And so I think it's taken some time for there to be an appreciation and a little bit more understanding brought to the work culture.
Yeah. You wrote in the paper that there is a small community where these traumatic experiences have been taken into account a little bit more holistically, and that's the drone operators community. Could you talk a little bit about that?
Yeah, one of the only places that research has been done is drone operators, and that's been done often in the Air Force, drone operators. And so there is an appreciation, I think, of that sort of function, that job function, and how that can be difficult. Drone operators, for those that are unaware, drone operators are often here in the United States, they aren't even deployed forward alongside troops, and they're seeing these feeds from unmanned platforms like Predators, of what's going on in the battlefield, and sometimes they're even making decisions, like they're determining, yes, that is the enemy target. You can fire the missile on that drone, and so they're kind of one foot in the war, but they're physically out of the war. And so those were very difficult jobs for a lot of the service members who were doing them. They would be they're virtually in Iraq and Afghanistan during the conflict and then go home to their families. At least as Dick was mentioning, my deployments are very surreal. You can't really talk about it, but you're in it. It's a very different environment. I remember coming home from my deployments and being confused that anything had happened in the 3 or 4 months that I was gone. Oh, someone got married or engaged or something. Because for me, time stood still when I got on that plane to go to Iraq, and the real world restarted when I got home. And so that did, I think, allow me to have some sort of emotional buffer. May have meant I wasn't processing what I was experiencing there, but you could be. This isn't the real world.
Close to, yeah.
That's right. Yeah. That's right. But a lot of drone operators haven't had that luxury. So there is some research that's been done in that space, but not really for the intelligence community broadly.
What would you both wish you had? So sort of like, what would you have wanted to have to feel supported?
Yeah, I think that's a great question, because I do think there are well-meaning intentions that have tried to give the community that. And this is an example where execution is important. So my third tour overseas, when I came back from my deployment, I was required to sit down with a psychiatrist. And that hadn't happened previously. That was clearly kind of a new requirement as they realized that maybe this is something we should be doing. But it was useless. It was a waste of time, right? I'm going to sit down. I feel like I hadn't even out processed yet. And I sat down with a person I've never met before, for 10 minutes. And they asked me, how's everything? Yeah, I'm fine. I don't know you. I'm not going to reveal my deepest, darkest secrets to you, essentially, stranger. There's no actual trust or rapport that's been built with this person. And so it was just really pro forma. But I still believe well-intentioned, just badly executed. So I think what I would have wanted was to know what was okay, like to understand this is a person that you can talk to. Here's the parameters of the conversation. Just like you might know, like you have a rough sense of what your priest or what your lawyer is going to do with information.
Right.
Almost like a privacy bill of rights.
Yeah, it's not a gotcha kind of scenario. It is a serious debrief, but sort of like you want to be walked through like what that person's going to do with that information, what's going to happen. I sort of saw the same thing. I worked on a documentary several years ago on traumatic brain injury in the military, and it wasn't associated with Rand, but it was about service members who sustain like TBIs and come back, and that's kind of like another lasting direct trauma that they have, and it's hard for them to talk about because the TBIs lead to things like PTSD and things like that. They don't know who they can talk to about it. They don't know what happens if they do talk to someone. Dick.
Hits home a little bit, right?
Yeah.
With memory and physical and other defects that are longstanding.
Yeah, this was a good project. The Marines and the Navy at the time were trying a couple of new things, using like holistic centers of excellence that focused on things like yoga practices and acupuncture and just like things that the military hadn't previously tried to do before. And they were having some success with it, which was interesting.
Yeah. So interesting. You said like, what could help you? And I was like, well, you just mentioned some of these kind of new age kind of things.
Yeah, it seems like hippy dippy kind of stuff.
Yeah, exactly.
But like,
for lack of a better term, yeah. That if you talk to Dick Donahue in 2012, what do we have in terms of things, right? I mean, I went home like the day before Christmas. I think the day before Christmas Eve, so the 23rd, and I got ordered into a shift, and I was like, great, I want to go home and see my kid who was young and my wife and get ready for Christmas, and somebody got their throat slit at a train station, and I had to shove my hand in somebody's throat, and this other guy's getting arrested, and then I had to just hey, got to write a report and go home, and then hey, it's Christmas, fantastic, let's like wrap the gifts and stuff, and thinking back to what was there, there was stuff. I just don't know what was there, right? All I knew is that... You
mean like resources? There were resources?
I mean, anything. I don't know. Whatever is offered. I guess, other than kind of working the, 16-hour days, 4 days a week, was, thankfully we had a department gym where I would hit the gym or go for a run before work. I'd run, 13 miles before work and then go work, 12 or 16 hours. And then really be tired at the end of the day.
During which time you're on your feet and in and out.
Right.
Yeah.
So, just with the physical pounding of stuff too, and wearing the gun belt and all that, I could complain, but we're not here to do that. But I think that was my outlet, was doing that, which was also difficult when you get basically put in the hospital for months, and then I can't run to this day. So it's like, hey, that's taken away. And I think only by being in a really traumatic event, and being so like nearly dead, like very critically injured, was when you learn about things. You learn about like what your leadership is going to do if you're in a situation like this, right? Who's going to take care of your family? Who's going to watch your kid? Who's going to get somebody from the airport that's coming in here? Who's going to make sure you get the best medical care? Who's going to offer you? I don't even know what Reiki is to this day, but I did it. I don't know what it is, or like acupuncture. I did those things. I have like needles in my ears. What is this? Will this help me with my pain? I'll try whatever, right? And it was learning about all these different things, like department chaplain or like local chaplain or whomever. I think by way of being involved in a major incident that was covered in international news, kind of sped these things along, because you don't know until you need to know. If you need these things. And it really ranges from everything from like, hey, what do I do? How do I file for disability insurance? Who's going to make sure I get paid when I'm out? Because I hadn't planned for all these things, right? So it was really learning on the fly from not just like the mental, but the physical, but all these other things, downstream to paying the bills, to childcare, to, being, I guess, physically normal and able to do policing, to not being able to do that and living with the disability, living with short and long term and long lasting effects of a disability, and real life changes with that. Some of those things I don't think you're gonna one would normally or rationally want to be planning or thinking about or talking about, but I think that's also part of coming up with these protective factors. So if when you are exposed to trauma, whether it be physical trauma or the mental trauma or secondary trauma, that you have some of the things, whether it be at home, at the agency level, at the personal level, to sleep, diet, exercise, all these sorts of things, that you're ready, or that you can take on these challenges, or that you can reach out to the right person at the right time to do it.
I never thought about that, this idea that for law enforcement, the sort of physical aspect could be a really good coping mechanism, right? Fitness, and then the physical demands of the job. But yet you're in a job at really high risk of physical injury. And so when that happens, you've lost one of your main coping mechanisms. I also think that my community is maybe a little better structured to deal with this than Dick's community, than law enforcement, because the intelligence community is pretty structured and consolidated. There's a lot of questions that we haven't even really gotten to. Is what about these contractors who have security clearances but wouldn't get all of the sort of
part of an agency?
Yeah,
so
the benefits you'd get as from federal employment. That's a huge issue. But let's just start with the federal employees. There's only 18 agencies for them. And so they've got this structure in place where you could be getting services through your employer. Whereas law enforcement is such a sprawling enterprise. And then even if you know what a best practice is, then you have to try to figure out how to disseminate it amongst 19,000 law enforcement organizations. So
exactly. And I think that's part of the problem, right? If you have a great peer-to-peer program, right, where you're finding this works, that's sustainable at a large agency. But there's agencies of one, there's agencies of 5. Everything from the most rural place to right in Washington D.C. That what might work or be sustainable in one place might not be somewhere else, which can be certainly problematic. What I have seen, though, too, is that if you ask, people will come. So even folks from some of these larger places or larger peer support networks, they are willing to reach out if they're asked, but they have to know about it, too. So if they don't know about it, they can't help.
We found that in some of the response we got to the piece that we wrote about the intelligence community, that organizations that support veterans came to us because they'd never sort of thought about this community, right? But there's a lot of nonprofits, private organizations that are here to try to help law enforcement officers, to help veterans, but spies, not so much. And especially in the Iraq and Afghanistan conflicts, there were an incredible number of our intelligence officers who are forward deployed, who were there working alongside soldiers and sailors and service members. And the military has structures for this. The military has people like chaplains.
There are like very formal services in place There are formal services, and there's cultures that sort of understand who that person is and that they're available to you and how to use them. And those don't exist. They're not the same parallel sort of services for the intelligence community. Yeah. And Dick, you were saying that structure really is not there. If it is there, you didn't know that it was there beforehand. And
personally, I didn't even think about it. I just thought about my next shift.
Yeah.
My schedule for the next couple of days, getting my workout in. I mean, that was my that was my way to decompress and not, lose it for a lack of a better term. It was like, I need to make sure I get that exercise in the middle of my shift because I'm working all the time. So there's actually one thing I want to ask. I know we're running short on time, but one thing I've looked at is law enforcement and suicide, and even suicide data collection wasn't even formal until very recently. In a not-for-profit had to really start and get the ball rolling and start collecting data and stories on, and they're confidential unless shared by the family, but on officers that die by suicide. Whether or not related to the job or not, or somehow factored in, that it took a long time, right? We, the law enforcement community knew it was an issue. I think everybody knew of somebody, either at a department or a neighboring department or academy classmate, where this happened. But it took a long time for some of the focus and the data collection to come to light on that. And it's now kind of becoming national. It certainly is becoming national, and it's supported by, all the major, law enforcement trade organizations and unions and what have you, the folks that are involved in a lot of decision makings. And I know that in the law enforcement community, but is that something that's even being discussed or considered for the intelligence community?
I think, there's sensitivities around people's personal records in the intelligence community, right? So there's a lot of privacy kind of concerns. I think that makes it really difficult to even understand how many potential suicides there's been. There was a relatively prominent suicide a few years ago, in the sense of a fairly senior person. Was in the news
in the CIA, right?
Yeah, exactly. And so I think, sadly, those kinds of events are ones that can prompt a conversation about it. This was a circumstance where it seems that many of his colleagues were unaware that there may have even been suicide ideation, so it caught individuals by surprise and shocked many of them. One thing that's interesting is we heard suicide brought up in some of the interviews we did for this report in the context of that was situations where there might be recognition of a traumatic exposure, right? So I heard managers say, well, if someone committed suicide, then I would understand that I needed to bring in employee support for my staff. Like that I understand that's a secondary trauma exposure that we should be talking about. But that was sort of the only example. It was only that circumstance. It was, that very personal instance. There wasn't necessarily, for example, an acknowledgement that, well, what happens if you ask that person to watch hours and hours and hours of ISIS decapitation videos to look at, techniques, tactics, signatures of ISIS? What do maybe you think that should be? What if they are having to look at, pictures and footage from the cartels of atrocities they've committed in order to intimidate the civilian population, try to identify which cartel it is, or, you know, just to, because that's the report you read and that's the material that came in with it. I mean, the work is serious work.
Yeah.
And so there's an appreciation that it's serious. There's an appreciation that there's heavy content in it. But I just think there isn't exposure and awareness of the mental health risks that brings. Even I saw that even with very compassionate managers who really cared about their people and wanted to support them, it just wasn't in their list of things they were thinking about. You know, this, that, hey, that's something I should be considering, how that's affecting my staff. And then I think something that's really important to keep in mind for secondary trauma, I know I said it earlier, but that there's a cumulative effect of it. And so, just because you were able to do the job yesterday does not mean that you can do the job today. It does not mean that you can do the job tomorrow. And I think it can be really hard for employees who are coping with this, you know, that as that resilience starts to slowly break down, as they become sort of more emotionally fragile to it, to recognize what's happening and understand what they can do to try to help. Because they just want to do their jobs. I mean, the intelligence community is such a patriotic, dedicated workforce. And I feel like so many people are just going to blame themselves or not understand what's happened and just try to put their head down and push through. And that is, you know, that's not the only technique. That's not necessarily going to help them and help them when they really do need something else.
Yeah. What can these communities do so that the individuals in them can be supported?
I mean, I think awareness can go a long way in the intelligence community. Understanding what secondary trauma is, understanding how to describe it. If you're experiencing it, being able to articulate that, having a vocabulary that you understand, that someone that can help you also understands, I think that is actually very powerful and very important. I think then there needs to be services available to you. So there needs to be sufficient employee support sort of structures, employee assistance structures. I'm not sure whether they are sufficient now in the intelligence community. No one's ever done a study on that. So whether or not there are sufficient services, but there need to be services, and people need to feel like that it's not a choice between getting help and keeping their job. So people need to feel confident that they can get support without having to take on this great personal risk. And so I think that can happen through policies being transparent, through also just helping people maybe with some examples, understand what are situations where someone has sought mental health treatment in the intelligence community and it has not meant that their clearance has been taken away. So Dick, you know, talked about how he still got to keep his badge, you know, even though he went through this experience. And so having those stories that people understand that they're not making that trade-off up front when they even start to like ask the question. And then I think there's a lot that could be done in making sure that these issues are things that we train our managers about. We talk to them about it. They understand what this is. They understand what resources are available to them. They understand how to see signs that someone is struggling to manage traumatic stress so that they can make sure that they get the help that they need. I think that all of these things could be really helpful towards cultivating sort of a culture of mental wellness inside the IC.
In following on that, and speaking from the law enforcement lens, I'm still involved outside RAND in police training in officer safety and wellness, and I think they really go hand in hand. I talked about building up some of your protective factors. It's kind of encouraging a healthy culture that really hasn't existed or partially exists. It might exist within the individual, but certainly not across the 19,000 law enforcement agencies. Certainly not within certain agencies or under certain managers or under certain conditions as well. So, I think of it, when I go on the road, it's everything that I did wrong and right, because I didn't wear my vest every day. Stupid, right? I would say that's idiotic. I didn't sleep a lot. Sometimes I would sleep 4.5 hours, then go back into work. 5 hours, go back into work. I had a baby at home. I'd sleep in a different room on the couch and then going to work. Not the best decision. And then tell my partner, hey, why don't you drive today? Because, I feel like I've had a couple of drinks. That's how tired I am. and then, so again, it's knowing, what to do, but then also, doing it. It's the sleeping, the eating healthy, having a healthy, lifestyle, whether it be, physical fitness, but then there's the mental fitness aspect of these things too, whether it be, even from, I think, Heather, you mentioned the supervisory role, that reaching out, the recognizing the signs that somebody might need a day off or might need to go home early or might need to talk to somebody, and not being afraid to have that conversation. Because I think that's been one of these, there's tons of stigma in the law enforcement community that's led to poor outcomes, that's led to bad uses of force, that's led to accidents, that's led to killings, that's led to domestic violence, that's led to firings. And I know people that have been involved in that. Just off the top of my head, that's led to, alcohol abuse and substance abuse. I'm thinking I have people's phone numbers in my phone where I'm like, I know this has happened to these people, and it's really, we talk about the police profession as a brotherhood. Man or woman, doesn't matter. It's a brotherhood. Well, I think we need to think about, okay, if it's a brotherhood, well, we need to take care of this person, and sometimes that means having those difficult decisions, or maybe asking them to turn in their gun or badge for a little bit of time, or taking a few days off to to mentally regroup or physically regroup from something. I think there's some small incremental changes, and I know I rattled off a lot of different things, but it could be a extremely mundane, boring job. 5 minutes later, you're not going to come home for 24 hours because of what's going on at work. So it's difficult to plan for all that, but really building up these protective factors and minimizing your risks. I sound like a nerd now, right? I sound like some of the reading I've done, but as you've done, I've walked the walk, I've talked the talk, and I've only learned through my own mistakes. And I guess to some extent, some minor triumphs along the way.
I think we both come from really insular communities, and they're sort of trust-based communities. There's sort of a fraternity aspect. You mentioned brotherhood. I think that all of those traits can be negative potentially towards reporting, communicating needs, acknowledging these things, creating sort of this stigma-based culture. There's a positive opportunity with all of those traits too, right? If you can kind of push those values towards and destigmatize some of this towards like, hey, we trust each other, and you needing help does not mean I don't trust you, and I'm going to take care of you, and you are part of this community. So I do think it's making sure that all of those values that we're channeling the way in which they can be used positively and mitigating the way in which they could channel negatively.
Mm-hmm. Thank you both for sharing your stories and being on the show, and for all the research you do and all the work you do. I really appreciate it.
Thank you.
Great. Thank you.
That's it for today's episode. You can learn more about the topics that Heather and Dick and I discussed in the show notes at rand.org/podcast. RAND is a nonprofit institution that helps improve policy and decision-making through research and analysis.